So, madam, can you share a real life incidents where emotional strength, teamwork, and communication has made difference in patient's outcome in your career?
Yes, there are many incidences, especially when you are in a municipal hospital. You
Yeah.
get lot of patients,
Yes.
and there is variety of patients.
Yes.
But I will like to narrate here only one
Hmm.
incident where one fine morning, one of my surgeon friends, he came to meet me. He looked very disturbed. So I asked him the reason, and he told me that he is losing very young patient due to septicemia.
Oh.
So this patient had met with accident and he had lot of necrotic tissue and slough on his back and in the perianal area. He was very toxic. So he was just not allowing any surgeon or anyone to touch him or not even come near him.
Oh.
He was just screaming in the ward.
This must be around 30 years or so.
Yeah. Maybe younger to that,
Okay.
this patient. Just married he was. Married
Oh.
few months back. So he said that unless and until I remove that slough, this person can't be okay. Only with antibiotics I can treat him. I have to remove all that slough which is there and which is making him toxic. But I don't know what to do because he's just not allowing anyone to come near him. So I talked to my associate professor that time, Dr. Shweta Salgaonkar, who is a chief at KEM about in pain clinic.
Pain clinic, yeah.
And was very much always interested in alleviating every sort of pain the patient has. So she said, Madam, we will visit this patient. We will see what we can do best. We went to ward. We saw that there was one cot where he was kept and nobody near him. And he was screaming. And there was one IV bottle that also was kept away because otherwise he was going to remove even that. So, and he was tied to the bed. So we told surgeon that we will take the risk. And we talked to his relatives also, young wife and mother. We said we are ready to take the risk if you are ready to take the risk. So you have to talk to relatives very properly. So they said we are ready. You do, madam. जो आपको डॉक्टर करना है करो पर इसको बचाओ. So there is a drug catalog you are aware of.
Yeah.
What we did that in that bottle which was away from him, we could put Ketlar dose. We injected that dose in that bottle. Slowly the result came. He became very quiet. Such things are not done in ward. Remember,
In that time, in that era,
such things are not done in ward. But we had taken the risk to do this in ward. So as Ketla started going, reaching him, he became quiet. When he became very quiet, we were confident that now we can just take him, shift him to operation theatre. We immediately took him on trolley and we shifted him to operation theatre. There very quickly we gave him anesthesia, put a endotracheal tube, gave him long acting muscle relaxant, and yes, we had achieved what we wanted to achieve. Then of course surgeon did his work very methodically. He was very happy that he could remove all that slough and that toxic material. Then Shweta put epidural catheter and for pain relief she attached a pump through that catheter and we shifted him. Now next day morning when we went, he was looking cheerful because his pain had gone, that toxic material had gone, and his fever had come down, his pulse rate had come down, his toxicity was really coming down. He was giving smile to people.
So sometimes
So
you have
yes, so then we said that this is very good. Now again after 2 days this patient you have to take because the slough will not come out. So next day again we give, when he came for operation, we gave anesthetic agent through that epidural catheter which was in place. Again everything was done nicely. Within 8 days he was on his feet. He came to operation theatre to thank me and Shweta, and telling you it was such a happy moment for us.
Yeah.
That the patient who was otherwise we were going to lose.
Yeah.
Young patient who otherwise we were going to lose, we could save.
Yeah.
We could give him life. The mother and his young wife, they were so happy that
sometimes we have to
so
really
sometimes you have to take the risk.
Go beyond our
Sometimes
limits.
Beyond our limits. Everything, whatever written is in book, you should not follow. You should trust on
your
your
heart.
inner voice, what it
Yeah.
says. Take the risk. Communicate with surgeon, communicate with your the relatives, and go ahead, and you will get the result.
Yeah.
That is very important.
That was so satisfying and so
Very
inspiring story,
very
madam.
inspiring.
Yeah.
I still don't forget that patient, and so much so his wife still contacts me.
Yeah.
I had even gone to his house in Dombivli.
Wow.
She had invited me there.
Wow.
And still every Diwali she will send me happy Diwali wishes.
So every patient actually is not only one patient. It is one entire family. So we are gifting that patient back to that family.
Back to that family. We are giving
have
him
to remember
the life and gifting that patient to their relative.
Yeah,
we
their
call
relatives.
him patient, but
for them it is
their relative.
an important part of their family.
Family.
Yeah. Yes. Thank you, ma'am.